how do we manage rheumatoid arthritis otherwise to control the disease process? Today I'll be concentrating only on rheumatoid arthritis. The next topic, when I speak about pearls in rheumatology, I'll speak about the other arthritic diseases. Let us finish one disease at one point of time. So, what medications are given to control the disease process in rheumatoid? We have wonderful drugs available in the country. The first wonderful drug which is available in the country is a drug which is used in the treatment of malaria, which was called as chloroquine. A better avatar of chloroquine is available in the Indian market today, which is called hydroxychloroquine. The moment I mention hydroxychloroquine, you will definitely say, oh, hydroxychloroquine. Yeah, I know about it. It is used for the treatment of COVID. After COVID came, hydroxychloroquine became very popular thanks to the encouragement given by certain people in this world. Hydroxychloroquine has actually become a household name, more popular than even the creator. Let me tell you one thing, ladies and gentlemen. Hydroxychloroquine is useless in the treatment or prevention of COVID infection. Let me tell you this very, very important point. Initially, everybody jumped into the bandwagon of hydroxychloroquine and said, we have found a cure. This is a drug which will prevent COVID infection. This is a drug which will cure COVID infection. It is all a mirage in the desert, and hydroxychloroquine role in the treatment of COVID has met its Waterloo and it is buried deep in a graveyard. But hydroxychloroquine is a wonderful darling drug of the rheumatologist. It's a wonderful drug to treat rheumatological conditions. It can be given to patients with rheumatic diseases even during this COVID times. It is not contraindicated in patients with rheumatological diseases during the COVID times. It is absolutely a myth that you should avoid hydroxychloroquine in patients with rheumatic diseases in this COVID environment or this COVID pandemic. So when we doctors prescribe hydroxychloroquine to patients with rheumatoid arthritis, they should not stop the medication because the neighbor said hydroxychloroquine is very dangerous to the heart. It causes heart attack. In my 35 years of experience, I can tell you absolutely the truth, pledging the little wisdom I have inside my empty scalp and my empty skull, that hydroxychloroquine is safe to be given in patients with COVID times with rheumatological diseases. It's a wonderful drug, very easily available, economical. It has to be taken only orally. It should be taken one tablet once a day or twice a day after food, because it can cause a little amount of nausea, that is vomiting sensation. It's a wonderful drug which is safe during pregnancy, absolutely safe in the lactating mother who was breastfeeding the child, absolutely safe even when a lady wants to conceive and have a child. It is a wonderful drug of choice, and hydroxychloroquine is much patronized by all rheumatologists all over the world, and it has withstood the test of time to emerge as a winner. Again, I would like to repeat you, hydroxychloroquine does not prevent the development of COVID infection, is not curative for COVID infection at all. The second drug which we usually give to patients with rheumatoid arthritis is a drug called methotrexate, which some of your relatives would have been prescribed when they have rheumatoid arthritis. Now, if you go and take my prescription in which I have prescribed methotrexate and you go to the pharmacy, the pharmacist is a person who knows more than doctors. Some people are extremely good. I don't say all of them are bad. Some people are arrogant and what I would say impertinent enough to go and tell the patient this is an anti-cancer drug. More than that, the greatest impertinence is with patients. Once you prescribe the methotrexate, immediately you will get into the web and find out about everything about methotrexate. And what all will be given in the internet? All wrong information, all side effects. I can tell you one thing. Even if you eat the food you prepare yourself, you can have a side effect. I'm telling you one thing. Any drug which has got an effect will have a side effect. That's very, very important. If you take a marriage, whether you marry one person or many persons, still there are side effects for me. There are good effects and side effects. Without side effects, there is nothing in this world. Absolutely nothing can exist without a side effect, because a side effect is nothing but an extension of the effect itself. That's important. So methotrexate is not a dangerous drug. For rheumatoid arthritis, the dosage we give is absolutely a mosquito-like dosage. We give 15 to 25 milligram per week, whereas in malignancy, we give 50 milligrams and 100 milligrams also. So methotrexate is a very safe drug which can be given to patients with rheumatoid arthritis, and it is the most wonderful drug available in the world to control rheumatoid arthritis. In fact, we rheumatologists tell that rheumatoid arthritis is like a methotrexate deficiency disease. Every patient with rheumatoid arthritis, you can give methotrexate. But ladies and gentlemen, remember one important point. Methotrexate is given only once a week. The doctor will clearly write that methotrexate is given only once a week, and there are some people who will take it daily. That's very important. So methotrexate is a wonderful drug prescribed by the doctor to be taken only on doctor's prescription. And the other most important of methotrexate is it should not be taken in any woman or any man who wants to have a child. It should not contraindicated totally in a pregnant woman or in a breastfeeding mother. It's very dangerous. Taken during pregnancy, it is teratogenic. It can cause harmful fetal effects. When you give it to a breastfeeding mother, then it can go across to the child through the breast milk, and it can cause side effects to the child. The last drug which is available in the useful of treatment of rheumatoid arthritis is a wonderful darling drug which is available in the Indian market today, what we call as biologics. Don't get frightened about the term biologics. Biologics are missiles which act against specific messengers involved in the process of inflammation. We have wonderful biologics available in the market, and these drugs are capable of reducing the progression of the disease in rheumatoid arthritis. And when the doctor prescribes you a biologic, he'll explain to you what is a biologic, how often you take the biologic, what are the side effects of the biologic, and whether you have to take it lifelong or whether you take it for a short period of time. The next important one, the role of lifestyle modification. All patients with rheumatoid arthritis should definitely go and see a physiotherapist for all exercises for the joints, what we call as a range of motion of the joints. They should also see for muscle strengthening exercises, and they should also ask them how to take care of their posture. See, we all evolved from a monkey. So what happened? In the process of evolution, all of us ultimately learned how to stand straight. So one important fact is adopting the right posture even in a patient with rheumatoid arthritis is very important. The physiotherapist can give other things like heat fermentation. He will teach you some exercises. You can have heat fermentation exercises even at home. You can have a hot water bag fermentation, or you can have a heat pad. Sometimes people can even use ice on them, what we call as ice fermentation, which is definitely will bring down the inflammation as such. The modalities of physiotherapy which you have to be given will be chosen by the physiotherapist in conjunction with the rheumatologist, and they both of them will decide together what is the exercise program which needs to be given to you. Now what happens when you give an exercise program to the patient? Very nice people. We are all very lovable people in this world. You will learn the exercise. You will go home and sleep nicely, not do the exercise, and expect the doctor or the physiotherapist to do the exercise. That's not very important. It's like people, no, when they are little obese, they'll come and say, Doc, I have to go and meet the dietitian. Please tell me the best dietitian in the world. I'll go and meet. So he'll go and spend 1.5 hours with the dietitian, and he'll tell the dietitian will tell what not to eat and what to eat, what not to eat, what to avoid, etc. The paper will come. It will go under the dining table, and he will eat like a Greek. In fact, the people in Greek in earlier days, they will eat whatever they want. They'll become very fat also. A diet is given to a person to follow. An exercise program is given to a person to follow. It is not for the doctor or the physiotherapist to follow. That's important. Since rheumatoid arthritis affects the joints, people are little incapacitated. They become dependent on others. Let me tell you one thing. Only when we go through pain and swelling, we know how difficult it is. So the family should be absolutely empathetic to the patient with rheumatoid arthritis. See, these patients with arthritis, like any other person with disease, will ask me the question, why did I develop the disease? You can't be philosophical and say why you should not develop the disease. When good things happen to you, did you ask God why it happened to me? Only when bad things happen to you, you're asking God why it happened to me. It's all right. It's very philosophical. But practically in life, here is a person who's got arthritis, suffering and pain, and going and talking to him the philosophy of karma, good and bad karma is not right at that point of time. You won't be receptive. So kindly be empathetic. The wife can have rheumatoid, the husband and the children should help. The husband, the male member can have a rheumatoid, the family members should cooperate. Your mother, father, or grandmother or grandfather can have rheumatoid. Everybody should help patients with arthritis. That's very, very important. Because you know how difficult it is to be dependent. All of us will always say, till I go to the grave, I will not be dependent on anybody. But let me tell you one thing, even if you have to the grave, you require 4 people to carry you to the grave. But now in this COVID times, you don't even require 4 people to carry you to the grave. If they are COVID, then directly the corporation takes care of the funeral. So rheumatoid arthritis is a disabling disorder. We have to treat with medications, physiotherapy, exercises, lifestyle modification, and drug treatment. Now people are asking questions about which I shall get along now. I feel weird movement and sound in my fingers nowadays, especially in the morning after waking up. I feel my fingers don't have the strength as earlier. Can you tell me what could be the reason for this? Yeah, this question, gentleman or lady, whoever has asked me, I can only say that this is not a weird question. It is quite common in all of us, including rheumatologists. It is nothing but air bubbles breaking into the joint. It's not a problem at all. In fact, in the circus, no, these people will keep breaking their knuckles at that and making noise, and all of us will laugh at them because they're clowns to make us laugh. But I can tell you this is not a dangerous problem, but don't get addicted, no, of breaking your knuckles. That's important. People get addicted to it. Like how they get addicted to the cell and messages. These people get addicted and keep on making this noise. We can listen to better music rather than the noise of your own knuckles breaking down. It will not cause, it can cause degeneration of the joint in the long run. Please do not do that. Very good question. What is the reason for the pain in the heel and what is the best way to get this treated? Now, the important problem here is some of us, including rheumatologists and doctors, when they get up in the morning, the heel will be very, very painful and the first few steps will be very, very painful. Fortunately, Neil Armstrong, when he landed and put his first footstep on the moon, if he had heel pain, he would not have landed on the moon at all. This is because we have a cushion called plantar fascia in the heel, which gets angry or inflamed, and we call it as plantar fasciitis. And this is very, very common, most common in people who are obese, most common in people who have a flat feet. How do you treat them? To treat them, what do? We ask them to take contrast bath. That is, we'll ask them to keep their feet in cold water to an appreciable extent for about a minute. Keep it in warm water to an appreciable extent, the temperature for about 1 minute, 1 minute and 1 minute and 1 minute and 1 minute, about 5 to 10 times twice a day will definitely help them. And what we ask them to do is to do the ankle stretching exercises. These ankle stretching exercises will improve the blood circulation to the fascia and the pain will become better. The most appropriate treatment for heel pain is to reduce the body weight and use the right footwear. Unfortunately, I do not know why people should wear all types of pointed shoes and high heels, etc. You need not look tall in this world. Physically, if you're tall, it doesn't mean anything. What you should do is to become a giant mentally and intellectually. That's very, very important. You should wear soft slippers, rubber cushion slippers, or you have various fashion made slippers available in the world, which you can always order. And this pair of slippers are not only worn outside, but also they should be worn inside the house. What do you suggest if you have scoliosis and it hurts? I'm extremely sorry, but I can give you only one question, an answer for this question. If you have scoliosis, it is better and it hurts, you have to consult a spine surgeon. Scoliosis is a condition where the spine gets bent like this, and in this particular condition, you have to see only a spine surgeon who will tell you whether it's to get operated or not operated. All patients with scoliosis do not get operated. The doctor will decide. So what you have to do, if the scoliosis is there, it is congenital, it can run in families, and you see a spine surgeon. Sir, good evening. My blood tests are normal. I do not know, and my blood tests are normal. I think probably he has got joint pain or he or she has got joint pain and the blood tests are normal. If clinically the doctor is not able to make out arthritis in you, then your blood tests are normal. Be absolutely fine that everything is normal. Lot of mental tension can also have a very bad effect on you. We have what is called the relationship between the mind and the body, the psyche and the soma. Mentally tense people can also develop joint pain and muscle pain. So you have to relax yourself. What you need to do is to get into meditation. You get into yoga. Yoga was born in this country. It is adopted by the West, and the West are saying yoga is the best, whereas the East is still not agreeing much with yoga. Now yoga has become extremely popular in India. You have to get into yoga, pranayam, breathing exercises, meditation, calm down your mind. Once you calm down the mind, even in rheumatoid arthritis, the joint pain will become